Hi, everyone. My name is Dr. Michael Wald, and welcome to another installment of my master's nutrition program that I'm giving as part of my weekly radio show known as Ask the Blood Detective on prnfm.com. If you want to review some of my other show topics, you can go to prnfm.com and search for Ask the Blood Detective, or you can go to my website at drmichaelwald.com and search the search bar on the homepage, or go right to the blog section and click on any of the titles, and some of these Zoom presentations will pop up. So for those of you who don't know me, once again, my name is Dr. Michael Wald, and welcome to this comprehensive conversation today about prostate cancer. I wanted to also mention that although I'm talking about prostate cancer prevention, treatment, and nutritional approaches, hence the title of today's talk, virtually any cancer has some applicability to the concepts that I'll be talking about. In other words, regardless of the cancer that you or a friend or a loved one might have, or perhaps you're just watching this for educational purposes, there are certain underlying mechanisms that are involved in most cancers, and there may be many nutritional possibilities. So again, even if you're not interested in prostate cancer specifically, I would listen very carefully. Now, you should know too that this presentation is not that watered down, which means I will do my very best to clarify concepts, but it's meant for physicians that have no knowledge in this area to bring them up to speed. So hence I must give the right terms. But it also is meant for an individual who's very serious about learning correct, reasonably safe methods of nutritional possibilities in a variety of cancers. So I might be speaking about prostate cancer, but again, keep that in mind as we move along. So I should first give the disclaimer, basically, that the information that I'll be discussing is meant for your educational only. It is not meant to act as a substitute for sound medical or health advice, and any use or misuse of this information is on you. So please don't do any of this nutritional stuff without consulting with a qualified specialist or specialists. These are some of my credentials. You can find many more of my credentials, including acupuncture, on my website at drmichaelwald.com. That's drmichaelwald.com. Or you can also email me regarding the content of this talk or your feedback by emailing me at info@blooddetective.com. That's info@blooddetective.com. You can also call me if you're interested in seeing me as a patient at 914-552-1442. So let's talk about a couple of very, very interesting things. Now, at the top, the titles here are mostly the titles I've taken from actual studies that you can find on either the Cochrane database or the National Library of Medicine. Those are the two main places where physicians and health practitioners should be going for accurate studies. So this was a population-based study trying to find out like who's using alternative, holistic, or complementary healthcare. All those are different acronyms. So listen to some of these statistics. So 39% of patients use complementary therapies, the most common being the use of herbal supplements like saw palmetto, vitamin E, and minerals like selenium. The most commonly used or touted reason for using these natural approaches is to boost the immune system. And by the way, in cancers, it's not always a lowered immune system situation. There are other ways in which cancer can propagate through the body that have nothing to do with your immune system. So it also says here the majority of men, 58%, told their physicians about their alternative medicine use. In my experience, many patients do not tell their other doctors because they're afraid they're going to be ridiculed or made fun of or otherwise humiliated. And I have found that is true. Many patients report that to me. So I'm not saying that you shouldn't tell your practitioners, but you should be prepared for the worst. So also we know that most people get their information about how to use alternative therapies or complementary therapies from their family and friends, so not particularly reliable sources. And by the way, just because nutritional therapies may have worked on a friend doesn't mean they'll work on you or anyone else. So it's important that you seek advice so you can be properly evaluated to see if you're a good candidate for nutritional and natural therapies. So what is the main approach to prostate cancer these days? First of all, we know that the current approaches to the management of prostate cancer include surgery, radiation, hormonal manipulation like hormonal blockers, or some sort of combination of these. Prostate cancer does remain the #1 most common malignancy among men and the second leading cause of cancerous deaths in the United States. Several conventional therapies are available. I mentioned some of them, but they're not particularly effective. So because of this, at least it's my opinion, we should be looking at nutritional and natural therapies at the very least as an adjunctive, as a combination with the standard therapies, because we know that nutritional therapies, when used right, reduce risk of infection, reduce side effects from chemotherapy, radiation, and surgery. They enhance recovery. They can boost the immune system and reduce inflammation, maintain lean body mass. There's all sorts of proven ways in which nutrition in a person with cancer can be used correctly to help their general status. So I want to review with you a couple of important concepts which I hear a lot. So I've been in practice for over 30 years, and I hold many degrees and certifications in the area of nutrition and natural health. And these are some of the things that people say are issues. So number one, nutrition plays a role in cancer treatment and prevention. Yes, it definitely does. Some people are confused about this. Some of my patients, for example, because prior to me, all their doctors, and many of them are very qualified, have said, no, there isn't any research in this area. That is just an ignorant statement, because anyone can go on the Cochrane database or the National Library of Medicine. The National Library of Medicine, for example, has over 3 million articles from various scientific journals reaching back from 1966 to the present, and it's very easy to use, and you can easily find the evidence. So the reason why physicians are saying that is because they probably honestly don't know, because it's not part of their training to do nutrition. They have no interest in it, so therefore they tell their patients that there hasn't been any studies. It also doesn't hurt that most medical schools have an average of about 27 hours of nutrition training, so physicians just don't have the training. Diet and nutritional supplements may be an essential part of a comprehensive plan for a cancer patient. My response to that statement is yes. The proper use and balance of the right nutrients and the right diet and other natural approaches for the right person at the right time in the right doses can improve the entire cancer situation. Oncologists are not trained in nutrition. That is true. Their only nutrition, unless they get extra nutrition and education, is usually very early on in medical school, a couple of nutrition courses that are provided, and they're very, very basic. And then my other statement here, dietitians are not, generally speaking, adequately trained to fully manage the nutritional needs of cancer patients. That, in my opinion, is true. Being a certified dietitian nutritionist and a certified nutrition specialist, those are the two more commonly accepted designations of qualified nutritionists, at least in the state of New York. I can tell you that my dietitian education was basic. It was the food pyramid, and look, everyone knows about the horrific state of hospitals, hospital-based food. You know, even the average person recognizes that's not healthy. I hear this all the time, but for some reason, this is what dietitians do. If a dietitian under the guidance of a trained oncologist, and if they are both knowledgeable in advanced nutritional concepts, they can, of course, then put a coherent, good plan together for an individual. The number one cause of cancer deaths is malnutrition and infections. That is often true. And we know that proper nutrition can manage malnutrition, and good nutrition boosts the immune system, which reduces risk of infections. And then the other bullet here is that laboratory work is needed to define individual nutritional needs. That's true. And the last statement here says biochemical individuality is the key. There was a Nobel Prize winning chemist or biologist, it might be, a Dr. Roger Williams, and he's deceased now, but he wrote many books on nutrition. And again, this is a Nobel Prize winner. So if this guy says that nutrition can work and is missing from medicine, I believe it. And I know this from my 30 plus years of experience, as I mentioned. More misconceptions. Again, dietitians, they may not know enough in this area unless they're someone like me who's done extra studying. And then there are clinical nutritionists. In my experience, a clinical nutritionist is a little different than a dietitian, but they're roughly equal in knowledge regarding nutrition, diet, and cancer, so not really up to par. But remember, these practitioners could have advanced training, but you'd want to ask them about that. Don't just assume that any nutritional specialist that you visit has the same qualifications. Many of my patients, by the way, had gone to many different nutritionists prior to me because they were trying to save money. They were price shopping, and that's not always the way to go. I'm just being very frank. And then we need to work together with all the other members of the medical team if someone's having cancer. So I do not hesitate to talk with oncologists if that will enhance the care that my patient is getting. And then nutritional work in the laboratory. So most regular physicians are also not trained in nutrition. I have 2 board certifications in nutrition. I have a master's degree in nutrition and some of the other qualifications that I mentioned. I can tell you that this is an entirely different specialty, and it's not easy. Just like any medical specialty or healthcare specialty, it takes time and dedication. The nutritional interpretation of lab is an advanced sort of concept. So when a physician, or let's say a general practitioner, or even an oncologist reads their limited laboratory work, there's very little nutrition, if any, involved in that workup. I mean, if you get a vitamin D test, that would be extraordinary from what I see today. But I'm trained in the use of nutritional interpreting laboratory work and ordering nutritional tests that might be of importance that are not standard tests. Lots of my patients with cancer will come in and say, Dr. Wald, you know, I've seen these other doctors and I've had every test under the sun. They think that, but there are thousands of tests. And sometimes I look at these tests and I see that things are missing or abnormalities were not even noticed. So again, you need to be aware of the training of your practitioner of nutrition. Lots of my patients will also say, Dr. Wald, I'm not sure if you can help me because my other doctors have said that my laboratory work is normal. And this is a person with cancer. Clearly, if their laboratory work is normal and they have cancer, their laboratory work is either incomplete and or misinterpreted, at the very least, those 2 things. Plus, when you order other types of tests, let's say like vitamin D or protein tests, things of that nature, they may show abnormalities when the test that you had done simply did not. And there are non-blood tests that are very important for cancer patients. For example, a bioimpedance test or a body composition test is a simple, inexpensive test to measure metabolic rate and the percentage of lean mass on the body and other things. And that test, for example, helps me dose patients in terms of proper protein, carbohydrate, and healthy fat intake, and also nutritional supplement dosing based on lean body mass. If you don't know lean body mass, that's a problem because in cancer, lean mass is lost. It's a condition known as sarcopenia. And that means a loss of resiliency and a loss of lean mass and energy production in the body. And that's a typical finding in cancer patients. So you can measure that indirectly with a bioimpedance test. And you can check that the nutritional efforts that you're making are actually working. Let's look back at these bullets here. I always ate well throughout my life, so how did I get cancer? That is a great question, but here's one of the possible responses to that. Number 1, you didn't eat as well as you thought. When I question people, I ask them a few questions. I find very quickly that many individuals who think they know nutrition really don't know as much as they think they do. And on the other hand, even when I've interviewed people and have seen that, yes, they seem to know a lot of good nutrition and correct nutrition for their cancer and their general health problems, they've only been practicing those things for maybe a handful of years. 5 or 10 years in a life that's 50 and 60 years or more is not that much. So, you know, whether or not you have a healthy diet for cancer is that also brings up the question, well, what is a healthy diet? Is it a paleo diet? Is it a macrobiotic diet? Is it a high protein diet? Is it a low protein diet? Is it a high fat diet? Is it an anti-inflammatory diet? Is it a high ketogenic diet? Is it a vegan diet? Is it a vegetarian diet? I could go on. The way I figure out food plans for my patients is I evaluate their overall health and well-being. They're more than just their cancer, as well as their cancer diagnosis. And depending upon that, laboratory findings, their goals, are they getting chemo, are they not getting chemo, are they getting radiation and surgery, are they not? That all determines how I put together a food plan. And a food plan may change over the course of weeks or even months as the person's health status changes. Let's go back to the bullets. And then there's, genetics. So what do you do if you have a cancer that's genetic? Is prostate cancer genetic in origin? Well, in a sense, it is in this sense. First of all, they're known as epigenetic changes. Epigenetics means, fundamentally speaking, that there are environmental influences upon your genes. So for example, air pollution, we know that air pollution probably causes lots of different health problems, anything from autoimmune disease to thyroid problems to many different cancers. Even diabetes is thought to be the #1 cause of cancer, not sugar, okay? So the thing is, genes can be altered. And the earlier that genes are altered, they can be altered with diet, they can be altered with stress management, they can be altered with proper sleep. And there's other methods of managing how genes express various phytonutrients or plant nutrients, which we'll be speaking about during this presentation. Super important to have positive effects upon epigenetic, what's known as epigenetic expression, how the genes express. They express in a cancerous way, well, there's a problem. If they express in an anti-cancerous way, about the use of phytonutrients and vitamin D and vitamin A and things of that nature, zinc, then that's what you want. Then this other statement, third to the last, is there's no scientific evidence to justify nutrition. That's just absolutely false. I have had doctors say to me, yeah, there's no evidence to justify nutrition and supplements. I say, well, do you give iron to your anemic patients? And they'll say, well, yeah. I'll say, well, do you give calcium to patients with bone loss? They'll say, yes. I'll say, well, do you believe in a vegan or vegetarian diet now for reducing all cause of disease and autoimmune disease and heart disease, as was in the American Medical Association's journals and other scientific journals? And they start to realize that they know a lot more than they think, and they were just giving sort of a rote answer that there's no evidence, but it's not. Of course, there's evidence for nutrition. Does medicine have all the answers? Of course they don't. Does natural medicine have all the answers in nutrition? No. But the smart synthesis of that together gives the greatest possibility of a positive outcome. So here's a few more misconceptions. If I eat a balanced, healthy diet, let's say you know what that is. Is that all you need? No, because you are not what you eat. You're what you absorb from what you eat. And if you have cancer, you have a hypermetabolic state. There's usually an increased need for a variety of nutrients that you might not be able to eat enough of the foods that contain those nutrients, those vitamins, those minerals, phytonutrients. So you have to take concentrates of nutritional supplements. Okay, so diet is not all you need. PubMed.com is where you can find scientific evidence. That is true. That website is loaded with millions of abstracts, which are summaries of the medical journal articles. You can pay, in most cases, to get the actual articles as well. But they're highly technical, so just keep that in mind before you spend a lot of money getting original articles. Will there be a magic bullet in cancer therapy? Well, they seem to be continually searching for that. I would say absolutely no. Maybe I'll be proven to be wrong. That would be fine. And the same thing with nutrition. There will never be one thing that's going to have a person manage or get rid of their cancer. And when we talk about cancer, we need to recognize that it's cancers. There's hundreds of different types of cancer. And even within the concept of prostate cancer or breast cancer or ovarian cancer, whatever cancer you're talking about, you have the individual whose body and they are dealing with their cancer very differently. The cancer is expressing uniquely in that individual. Even if you're said to have the same stage as another individual, there's lots of other influences in a person, everything from environmental exposure, genetics, are they taking medications, what's their current health right now? In other words, there are factors beyond the diagnosis that make this an individual issue. So I have to take one patient at a time to determine what the biochemistry says they need, what the medical journal says that a person needs for their cancer, and what the biochemical testing of that individual also says, along with my 30-something years of clinical experience. So you need to know the person or practitioners that you're seeing so that you're bringing the most to the table. And then the third to last bullet, cancer is about reduced immunity. As I mentioned earlier, that's only one factor that might be at play. Nutrients work immediately in cancer? No, some work more faster than others, but the sooner you start, the better. And then this concept of an alkaline pH, you know, you've heard this before, acid-base balance and how you want to be alkaline. Well, as I've said in my other presentations, that is ridiculous. What do you mean by being alkaline? So for example, we need an alkaline environment in our mouths so the starch digesting enzyme amylase works. We need acid in our stomach. If we don't have betaine, hydrochloride, and pepsin in our stomach to break down proteins, then and cleave B12 from proteins, to ionize calcium, to cleave iron from proteins in the diet, for example, then we're going to have problems with nutrition. So I always want to make sure that my cancer patients are digesting properly, they're absorbing properly. Now, as far as this pH, as I was saying, blood pH should be on average at about 7.4. If someone is below 7.35 or above 7.45, now we're talking blood, people. We're not talking about saliva or urine. And I emphasize that because there's a lot of misinformation on there about pH. If you listen to my radio show, which you can search for at my website at www.drmichaelwald.com, search the search bar on the homepage for pH Lies. You'll have a 1-hour radio show that'll teach you everything you ever need to know about properly interpreting a pH. There is a role of proper pH in cancer, but it's not having to do with making the person alkaline. If a person actually had alkaline blood, they would not, that's not a survivable situation, certainly not for the long run. And it's also true that if a person certainly doesn't have acid blood, the closest to that I can think of would be a person with diabetes that's very uncontrolled, and they have a condition known as diabetic ketoacidosis, which can put that person in a coma. So, but more subtle abnormalities in pH do make a difference, but not this whole alkaline concept. You need to be acid where you need to be acid. You need to be alkaline where you need to be alkaline. Pretty simple. So here's a study using a nutrient found in plants known as quercetin, and how quercetin inhibited cancer of the prostate by inhibiting what they call anti-apoptic pathways. So apoptosis is a term referring to cancer cell death. And in prostate cancer and many other cancers, that process may be inhibited. But they know that quercetin promotes apoptosis, which is beneficial for cancer because apoptosis is, as I said, is cancer cell death. So it says right here that the results of the study demonstrated that quercetin exerts anti-cancer effects. And it goes into more detail here on the different pathways that it modulates. And it would be a very important part of someone's anti-cancer approach, although you wouldn't want to use just one thing. There's no way you're going to get a strong anti-cancer effect from one thing, in my opinion. It's just not the smartest way to do it. You want to use many different synergistic nutrients together, which will have the greatest opportunity to help an individual patient. Now, here's a very interesting set of findings from a study on melatonin for prevention and treatment of prostate cancer, but this is also true for breast cancer and some other cancers. So these epidemiological studies showed that various tumors respond favorably to melatonin. For example, melatonin is a very powerful antioxidant, and also it modulates certain receptors in the body which promote cancer cell death. Also, melatonin reduces the production of new blood cells, or new blood vessels, I should say, which can favor proliferation and worsening of cancer. And melatonin can improve tolerance to chemotherapy radiation. So let me read that statement to you. Melatonin can also be utilized as adjunctive of cancer therapies. That means using melatonin with other cancer therapies through reinforcing the therapeutic effects and reducing the side effects of chemotherapy and radiation. So for these doctors out there saying, don't take any nutrients because it could affect the chemotherapy and radiation that we're giving you, well, of course it does depend on the cancer, but they may not be aware of these studies. Some patients think that there's some sort of sinister reason why, or maybe money's involved and why doctors are not into nutrition, but I find that's just ignorance. I don't think it has anything to do with money. And the statement from the study also said that melatonin could be an excellent candidate for the prevention and treatment of several cancers, including breast cancer, prostate cancer, gastric cancer, and colorectal cancer. Now, the amount and dose is going to vary from individual to individual. It may be as little as 1 milligram and as high as 12 or 15 milligrams of melatonin, always given before bed. And here's an exciting concept. I only gave 1 or 2 references for this, but the use of green tea polyphenols. So the term polyphenol just refers to the structure of the elements in green tea that are so strongly anti-cancer. So green tea consumption is reported to play an important role in the prevention of cancer in many types of malignancies, including prostate cancer. And these green tea polyphenols when they're combined with other anti-cancer agents, work even better. We'll talk about that in a minute. So both for prevention and prostate cancer, there's lots of scientific evidence. The studies are right up there on Cochrane database and PubMed.com. So we know that the green tea polyphenols influence tumor growth, tumor cell death, which is apoptosis. They help to block androgen receptors because androgens can promote cancer in prostate cancer and also breast cancer and also in ovarian cancer. And here's a study on an amino acid, an activated form of L-carnitine known as AcetylL-carnitine. The conclusions of this study showed that they highlight the capability of acetyl-L-carnitine, that's abbreviated ALCAR, to down-modulate cancer cell growth, the adhesion of cancer cells, because cancer cells can stick to surfaces and other cancer cells come and they stick, and before you know it, you have a tumor. So acetyl-L-carnitine helps to offset that. Also the migration of cancer cells. So you can have a tube like a blood vessel and cancer cells can go through the tube so they can invaginate or exvaginate and invaginate into cells, but acetyl-L-carnitine offsets that as well. And this just is a general statement here. I just wanted to throw in here to kind of break up the monotony of the conversation, that 60 minutes of moderate or 30 minutes of vigorous exercise has been shown to reduce cancer onset. It's also shown to reduce or improve, I should say, cancer outcome. So in the right person who's properly nourished in the right physical condition, different amounts of exercise, I have to build my patient's exercise tolerance up in many cases because the very sick can't do this amount of exercise. So we figure out what's the best for them. But as a general rule, we want to be exercising during cancer therapy for lots of reasons that are beyond the scope of this particular talk. And this is interesting, the alleviation of multi-drug resistance by flavonoid and non-flavonoid compounds in plants for breast, lung, colorectal, and prostate cancer. So this means that plant products can help improve how drugs work. They are not interfering with them, particularly in this case. So they looked at solid cancers, which I mentioned were breast, colorectal, lung, and prostate cancer. And what they found here is the last bullet here. A major cause of cancer treatment failure and metastasis is the development of multi-drug resistance. Several phenolic compounds, and phenols are just referring to the shape of these structures microscopically, but they're all in plants and fruits and vegetables, act as chemopreventative agents due to their antioxidant abilities, their inhibition of cancer cell spreading and proliferation, survival of cancer cells, spreading of cancer cells, immune properties, and inflammation. I mean, that sounds like a miracle drug. It's not, but used in accordance with standard therapies is the best way to go. Of course, you'd want to talk about all of these concepts with your oncologist, and hopefully your oncologist is working with a clinical nutritionist to help them along the way. So we know here that, particularly in prostate cancer, although I can't really think, all the top 10 cancers I can think of, they also show studies similar to this. So a diet rich in polyphenols, which again are these plant compounds that are found in all fruits and vegetables, can slow down the progression of localized prostate cancer and prevent the occurrence of the disease in the first place. I mean, if this is so true and so important, how come this isn't part of the standard of care in oncology? Once again, I just think it's ignorance. The doctors just don't know about this information, and those that do begin to learn about it that I've talked to simply say, listen, I can't learn that whole specialty, so I just basically say, no, I don't use nutrition to my cancer patients because I don't know any nutrition, so I'm not comfortable managing them. And there's a certain logic to that. So if that's not logical to you, then of course you'd find an oncologist with a different opinion. So basically, these polyphenols I've put together in certain products that I make at blooddetective.com. So blooddetective.com is my nutritional supplement site. So most people ask me to mention that and what nutrients I have. None of the nutrients that I have on my website have been studied specifically in cancer care, but many of their ingredients have. So for example, I have products called superfoods, number 1, 2, 3, and 4, and they're different powdered super concentrates of polyphenols, like we're mentioning here. I give them to all of my cancer patients. I have very few cases where they would not be appropriate. But once again, you should not start on any additional nutrition unless you consult with your oncologist. So many of us have probably heard in the nutrition and health literature about lycopene. So lycopene is a red pigment. It's found in tomatoes and other red plant foods, both fruit and vegetable. So the anti-cancer effect, the non-toxicity, the safety, and preventative and therapeutic roles of lycopene have been investigated in several studies, and the evidence is amazing. So what this particular study was, they collected information from various anti-cancer studies. They found that lycopene helps to kill cancer cells, it helps spreading, it reduces metastatic spread. Now, taking lycopene alone, I mean, it sounds like that's all you would need, but the effects are weak. So that's why I place my patients on many dozens of different products. If I use my superfoods products, which are a highly concentrated form of plant products, for example, you might have the equivalent of 72 pieces of fruits and vegetables in a couple of scoops. I am not saying you should not eat fruits and vegetables. I'm not saying that my products are a substitute for a healthy diet, but you need to know that they exist. And specifically, lycopene's been found to suppress the progression, proliferation, and slowing down what's known as the cell cycle. So that reduces cancer growth. And here's just some information on grilling foods. Grilling animal products, whether it's red meat or white meat, produces potent carcinogens called heterocyclic amines, or HCAs, and polycyclic aromatic hydrocarbons. And these are highly toxic in everyone. So I would not ever, ever, ever grill animal products. So let's talk about the role of zinc in prostate cancer. And I should mention, when I talk about zinc, I might mention vitamin C or magnesium or different nutrients. There are different forms of these nutrients. So there's zinc orotate, there's zinc citrate, there's zinc chelate. So with my patients, depending on their whole situation, I determine the best form, the best dosing, the best timing of nutrients in foods relative to their cancer and the rest of their health concerns. When you look at nutrition for the hopes of improving your cancer outcome, don't just take nutrients that have been studied in your cancer. You need whatever other nutrients you need for whatever other health issues you have. So if you're, for example, if you have a lousy basic diet and it's low in protein, you need to manage that before you start popping a bunch of vitamin pills, because they're going to be undermined in terms of their effects. I hope that makes sense. So zinc functions as an antioxidant. Zinc deficiency leads to several diseases of the brain, the pancreas, the liver, the kidneys, and the reproductive organs, just to name a few. Zinc loss is known to occur during tumor growth and development of lots of cancers. The prostate in particular has a large zinc storage, and when that storage is reduced, prostate enlargement and prostate cancer risk increases. The prostate was also named after certain fatty acids that are stored in it called prostaglandins, E3s. So hence the word prostate from prostaglandins, which are gotten from omega-3 fatty acids, which are super important as anti-cancer agents. But folks, depending on the drugs you're receiving and other factors, your medications might have negative effects with nutrients. And there may be positive effects. So it's important that you let your doctors know what nutrition you're using, let your clinical nutritionists know. Hopefully they have doctorates, they can read blood, and they know nutrient-drug interactions, both positive and negative. And the interesting thing about zinc is, besides being important for immunity, which most people know, it's also been shown to help with COVID outcomes, along with other nutrients like N-acetylcysteine and turmeric, vitamin D and melatonin, all for COVID. They're not a substitute for, an inoculation, for example, but or other standard medical therapies, but they certainly might be used in addition. So the knowledge that zinc prevents the growth of prostate cancer suggests that zinc-mediated therapeutics, that means using zinc, could be an effective approach for cancer prevention and treatment, according to this study. So let's talk about the anti-tumor, anti-metastatic spread, anti-angiogenic activity of lactic acid. So lactic acid is another one of these polyphenolic compounds found in plant products. So you can eat bowls of fruits and vegetables every day. That would be difficult. And you should, of course, have those in your diet unless there's some reason you shouldn't. But having food concentrates also. I've been developing my superfoods concentrates for years and frequently update their formulas based upon studies just like this. So the gallic acid is in various fruits and vegetables. And as I mentioned, it's a strong antioxidant with anti-cancer properties. It's particularly high in berries, pomegranates, and dried fruits. The anti-tumor activity of gallic acid has been mostly attributed to its ability to reduce cancer cell proliferation or copying of more cancer cells. It also helps cancer cells die off. So they know that a gallic acid can do this. Now let's talk about radiation enhancement, because I'm always hearing from my patients, Dr. Wald, should I be taking these nutrients if I'm getting a radiation or chemotherapy? Well, the answer in your particular situation is I don't know, because I don't know you. But we would figure that out. But I'm letting you know that there was a study that looked at resveratrol, which you also have in plants and vegetables, and probably became most famous for its content in red wine. And resveratrol enhances radiation sensitivity in prostate cancer specifically, and in many other cancers, by the way, by inhibiting cell proliferation and promoting cell senescence and apoptosis, which basically are fancy terms for it helps to kill those cancer cells. And specifically, resveratrol enhances prostate cell response to radiation. So if you're going to get radiation, if you're choosing that therapy, you might want to talk to your doctor about the use of resveratrol because it enhances the effects. Let's talk about a little bit more about green tea and the risk of prostate cancer. And this was a systemic review and meta-analysis, which is one of the most respected ways of looking at studies in medicine. So phytochemicals, which are just chemicals in plants, are suggested to lower the risk of many cancers, many cancers. Green tea is considered a very effective one of those phytochemicals for a variety of cancers. Now, higher green tea consumption was linearly associated with reduced prostate cancer risk. The more green tea you have, the greater the anti-cancer effect. Or you can pop pills of ECGC, one of the active components in green tea. So beyond 7 cups and more, that's when you're really getting anti-cancer effects. And let's talk about curcumin. That's one of my favorite ones. Most people now are smart enough to know that curcumin alone is next to useless. Curcumin is a spice in turmeric. If you combine curcumin with black pepper fruit, or a registered trademark name known as biopterine, then you get an extremely high concentration of curcumin. So we know that extensive research over the past 50 years has shown that curcumin, which is, as I mentioned, a component of the golden spice turmeric, can modulate multiple signaling pathways in cancer. So multiple ways that cancer is promoted, and curcumin works on lots of them. And a lot of these phytonutrients do the same thing, but each of them may do it differently. And when you add them together, you get even greater effects. So what the second bullet says here, that dose escalating studies where they gave more and more and more of this stuff indicated the safety of curcumin in doses as high as 12 grams per day. So you need very high doses of curcumin to make these effects. But curcumin is a blood thinner, so is omega-3 fatty acids, so is ginkgo and other nutrients. So if you're on anticoagulants, again, you need to discuss your use of nutrition with those combinations. So let's talk a little bit about omega-3 fatty acids and some cancer trials. So over the past decades, there have been extensive study which looked at the therapeutic effects of omega-3 fatty acids in all kinds of human diseases, ranging from the cancers to cardiovascular and neurodegenerative diseases, also Alzheimer's, dementia, and special needs conditions. And we know from a cancer perspective that omega-3s can improve the efficacy and tolerability of chemotherapy. Just like resveratrol improves the sensitivity of radiation, omega-3s improve the tolerability of chemotherapy. Once again, if you choose chemotherapy, you want it to work. And these omega-3s help chemotherapy work. And the omega-3s and curcumin and resveratrol and Lactic Acid and Quercetin, a lot of these other nutrients, including vitamin D, and I can go on, all of these have been shown to help protect healthy cells from chemotherapy and radiations. A very, very important point. Let's talk about vitamin D, one of my favorite nutrients to talk about because it's mostly recommended wrong. So number one, studies have shown and implicated vitamin D deficiency as a risk factor for the development and progression of prostate cancer, but also breast cancer, ovarian cancer, many other types of cancers. So basically, vitamin D is anti-proliferative and it acts on various hormonal signaling pathways. So how much should you take? Well, I can give you some starting considerations. Number one, you should take the amount of vitamin D that you need. So you'd need a vitamin D3 blood test. The range on the blood test of vitamin D is 30 to 100. Now, there's something called a bell curve. The bell curve right in the middle of it at the highest point is where 95% of the population for a man or a woman in your age group are at. So then there's 2.5% this way and 2.5% this way on this bell curve, okay? So if you're less than 30, that's not good. I've heard doctors tell patients they're like 31, 32, 35. You're just a little off. No, you're not. You're a lot off compared to the middle, okay? So let me just break this down for you. The amount of vitamin D3 that you need, unless there's some reason not to give you this dose, is 50,000 units if your blood is deficient, less than 30, okay, of vitamin D3. So it would be 50,000 units once a week, not once a day, once a week for about 8 weeks. At the end of that time, you need to check the vitamin D3 levels. I also like to check vitamin D125 hydroxy D3, which is the type of vitamin D3, 125 it's called, that has to increase for you to know you're getting in the therapeutic levels. So most doctors just don't know how to give and adjust the vitamin D3 level. Let's talk about oxidative stress and prostate cancer progression. Again, this is true for many other cancers. Oxidative stress drives cancer. That's what it does. Reactive oxygen species are the little chemicals that drive oxidative stress. And we know that these plant phytonutrients and other antioxidants, they drive down this this oxidant stress, okay? And by doing that, by the way, by blocking oxidant stress, you help reduce invasion of cancer cells and the ability of cancer cells to get around in the body, what's called migration. So this is a study that was done on DIM, D-I-M, or diindol methane. Okay, this is a very, very important compound, been studied for decades for its anti-cancer effects on a variety of cancers. Really great studies. It's found in cruciferous vegetables. If you have low thyroid, you don't want to be on cruciferous vegetables unless you're taking thyroid medication, but still cruciferous vegetables can block thyroid function, can affect the intention of your thyroid medication. So, discuss that with your prescribing doctor if you have a hypothyroid condition, a low thyroid condition, either Hashimoto's or non-Hashimoto's hypothyroidism, okay? So basically though, DIM helps to modify various signaling pathways in human prostate cancer, which is a beneficial effect. Berries, oh, I love berries. Berries are loaded with not just agalic acid, but all these phytonutrients, which have, so many studies that if you try to read them all, let's say you read 50 a day, which is impossible. You could never read all of them, let's say in 10 years, easily. You probably need a few different lifetimes. So there isn't a lack of evidence here. We know that berries contain gallic acid and these other phytonutrients that have been shown to be very effective when an individual has a variety of cancers, cancers of the skin, cancer of the bladder, especially lung, esophagus, prostate, breast. So there's tons of studies on that. But again, supplements will provide you super high concentrations of these plant products that you simply could not eat enough. The same thing with strawberries and blueberries. All the other berries have these phenolic compounds called anthocyanosides, just fancy terms, flavonoids. All these terms are grouped under the phytonutrients, plant nutrients. Very, very, very important. And this is just a reiteration that the cruciferous vegetables contain the DIM, which we just spoke about, but also these glucosinolates and indole-3 carbanols and isoflavonoids. These are very strongly anti-cancer compounds in cruciferous vegetables. Here's one I haven't mentioned yet, known as cistosterol. So basically, cistosterol is the most abundant plant sterol in the human diet. It's got a structure very similar to cholesterol, and because it does, it helps to block cholesterol production. So it's one of the most effective natural ways of lowering cholesterol with basically no side effects. It's a medicine that's included in saw palmetto and devil's claw. They have beta-cistosterol in it. Beta-cistosterol alone is concentrated in many different supplements. It's known to be effective against enlarged prostate in human trials. It's an anti-cancer and anti-inflammatory agent. And as I mentioned, it lowers cholesterol. Here's a new one too that I haven't mentioned yet, the diffraction of bioactive mushroom extracts. These have many potent anti-cancer activities. And if you combine the diffraction mushrooms with IFN alpha, which is an immune boosting therapy in cancer, the two of these things work much better together than either one of them alone. So rather than 1 and 1 equaling 2, 1 and 1 equals like 6 in terms of their super synergistic effects. And as my second to last bullet here says about these mushrooms, the diffractions, due to a synergistic potentiation of these two agents, this leads to arrest or stopping or super slowing down of the G1 cell cycle, which is a cancer cycle. It also improves the immunotherapy used in some prostate cancer patients, which I mentioned is IFN alpha. So I'm asked the question about soy products quite a lot. You know, if I have a hormone-related cancer like ovarian, breast cancer, or prostate cancer, should I eat soy foods? So I'm going to give you one answer on this slide and then another answer on another slide. So soy appears to contain some components that resemble weak forms of hormones. So if that's true, if soy can mimic hormones, then clearly you don't want to use them if you have cancer. So most of the studies have investigated soy's role in cancer development, have dealt with hormone-related cancers of the breast and prostate. Not a lot of other cancers have been studied. So let's go a little further with this. So a meta-analysis was done, which means that's a study of all of the properly performed studies in medicine. So it turns out, no surprise, that lots of studies in medicine, which have been promoted to be good scientific studies that have appeared in respected medical journals, turn out, once they do a systematic, I should say, review of them, turn out that probably most are ridiculous and incorrect and biased and improperly performed and or interpreted. But the meta-analysis tends to minimize those problems. So the updated analysis on soy foods, because of their content of isoflavones, two of them particularly, one of the isoflavones in soy is known as genistein and the other one is daidzein. And they are associated with the higher consumption with lower risk of prostate cancer formation. 30 articles were included in this meta-analysis. And basically, we know we have a statistically significant association between soy consumption and decreased prostate cancer risk. But I consider this information relative to the individual that I'm sitting in front of, or who's sitting in front of me, or both ways. So depending upon the unique situation, I would make a decision whether or not I would include soy products or not. Traces of soy, that's not what you have to worry about. If you're worried about soy, you should be worried about having a brick or more worth of soy per day. Then you get into considerations of things like this. So just a couple of slides left. This is a very important one here. I'm going to summarize for you the general approach that you might want to consider when you're getting help or when you're trying to help someone else get help that has a cancerous situation going on. So they need to have a medical and health history consultation, obviously. Don't try to figure out nutrition based on searching the web. You know, I've done this. I've gone to these Facebook cancer groups, and let me tell you, folks, it is a nightmare. The information I have seen goes from absolutely wrong to ridiculous to just outright dangerous and irresponsible. And that is based on a good amount of time I've spent on these groups. So please do not get your information on social media. You may need basic laboratory tests, and you may need some tests you haven't had done yet. If you haven't had a vitamin D3 level, that might be something you want to ask your doctor for. If you haven't had a zinc test, if you haven't had a malabsorption test, if you haven't had a bioimpedance test, you might want to get those tests. Vitamin C tests, all that kind of stuff. Then you want your practitioner to be able to look at your food logs. You have to make sure that your caloric intake is correct, that your caloric intake is coming from the proper balance of protein, carbohydrates, and healthy fats. And without a food log, it's impossible to figure that out. And then the dietary recommendations would come from a careful review of your overall health status and your health history, what you're willing and not willing to do. Are you going to do chemo? Are you going to do radiation? Are you going to do surgery? You're not going to do those things. You only want nutrition. Do you want a combination? Do you exercise? What other medical problems do you have? These and other factors matter. Stress reduction. Nothing will reduce your immunity faster than stress. Stress also tends to increase inflammation. It tends to create depression and anxiety. These are things that are very adverse to cancer survival. And an exercise plan, as I mentioned earlier, with each person that I sit with, it's important to figure out what their exercise needs are. I am not in the habit of recommending unrealistic exercises for people that I can't possibly do. The same with the nutritional recommendations. If I make recommendations that are it's just ridiculous, too many supplements, too strict of a diet, sometimes that is necessary, but most of the time it's possible to make a food plan and a lifestyle plan that is doable and effective. And then nutritional laboratory tests, as I mentioned. I've just mentioned a few of them here. These are not all of them. Depending on your individual needs, different types of tests and different types of normals of different tests would be needed. Blood pH, I think, is important. My second to last bullet, identify and correct nutritional issues regarding overall health and well-being. So let me just emphasize that one more time, folks. Lots of people make this mistake of jumping onto social media, doing Google searches, trying to figure out their nutritional needs by doing searches like, prostate cancer and vitamin A, or, vitamin D3 and ovarian cancer, everything specific to their cancer. You're more than just your cancer diagnosis. Your cancer diagnosis and your other health concerns, if you have any, could be affecting your body in all kinds of ways. And there may be other nutritional needs that you have that might not come up in your searches. And also, you might find out that vitamin D is important and proteins are important, let's say in your cancer. But if you don't know the dosing of these things, then that's going to be a problem too. One of the most common errors that I find with individuals who try to figure all this stuff out on their own is they might even be taking the right nutrients, but they're taking the right nutrients in the wrong ways, at the wrong times, the wrong doses, and the wrong combinations. And another very, very important rabbit hole not to fall into is to not know the drug-nutrient interactions. If you are taking various medications, like I was sitting with a patient this morning, and I looked at his one-page list of medications, and he had a metabolic syndrome, which is high blood sugar, high blood pressure, high blood fats, and many other health problems. And his cardiologist never once looked at his supplement list. He had supplements there that are contraindicated, that should not be given with the medications that he was on. For example, he also had AFib, which is a condition which can promote clotting. And this patient was on 2 different blood thinners. And he was also taking omega-3 oils, and he was taking a turmeric. These are also blood thinners. He could have a hemorrhagic stroke and bleed too much. So there are times when nutrition cannot be used depending on what medications you are using. The next bullet here, actually, let me talk about the blood pH for a moment. I mentioned earlier the importance of blood pH, not saliva and urine pH, at least not in cancer care, unless you're getting urinary tract infections. That often happens when the urine is too alkaline. See, that's an example of where you do not want to be alkaline. You want to be on the acid side of things, which is why people take acidophilus, because it lends acidophilus to the urine and helps resolve approximately 30% of UTIs. So the right pH in the right place at the right time, manipulated with foods, exercise, stress reduction, sleep, and possibly nutritional supplements if needed. So the last bullet on here, recommendations of appropriate nutritional supplements to fit your needs based on your diagnosis, your unique situation, your medications, chemotherapy, and radiation. Can I say that enough? I can't. So let's go to the next to last slide. So I've given you an idea of at least some of the supplements that I use with my patients. Like I mentioned earlier, I am not recommending these supplements in place of your cancer care or in addition to your cancer care. You have to discuss these with your physician and your nutritionist, whatever nutritionist you might have. And also these particular supplements, my supplements, have not been used in studies. I use the studies to formulate my supplements, however. So I'll go through these quickly with you. We have DIM from cruciferous vegetables at the top. These average doses I've given on some of these things have nothing to do with you, so therefore they're not recommendations for you specifically or anyone else watching this video. And then I have a product called Immunobalance, which has the Diffraction mushrooms that I mentioned. Melatonin, I always start with at least 3 milligrams, and I include some other melatonin synergists. Doesn't matter if melatonin hasn't worked for you in the past for sleep. We're talking about anti-cancer effects. And then N-acetylcysteine, very important anti-cancer compound, very important for COVID as well. We are living in COVID times. Maybe we won't be by the time you watch this video, I hope. Omega-3 fatty acids. Omega-3 fatty acids, they reduce the side effects of chemotherapy I mentioned earlier. They do the same thing for radiation. Omega-3 fats also improve the flexibility of the membranes around cells, so it helps nutrients and chemotherapy to get through. Also improves cardiovascular health as well, and lots of chemotherapy increases risk of cardiac death. And then there's Prostate Max formula, which has the lycopenes and lots of the other phytonutrients, including saw palmetto in it. And then the superfood formulas, as I mentioned, I have 4 of them. Superfood green, orange, purple, red. Unless there's a specific reason that I wouldn't give one of those to a particular person, I always use all 4 at 1 full scoop per day minimum. All of these mixed together at the very same time in around 18 to 22 ounces of water. They taste delicious. And then you mix that up, you drink it either at once or throughout the course of your day. And then there's trans resveratrol, which I didn't mention specifically during this talk, but it is part of the phytonutrient family, extremely important. I'm sorry, I did mention it during the talk earlier when I spoke about it, improving radiation tolerance. It does a lot more than that. And then vitamin D3, usually people need about 5,000 units to start. They might need more. It's possible they might need less, but if someone has a level of 29 or below, the vitamin D3 range, then I start them at 5,000 if they have a concern, but really you're supposed to start them at 50,000 units or more if they're morbidly obese once a week for 8 weeks, then retest, then adjust the vitamin D level at that time. And then I mentioned zinc. Again, I like using zinc, a bisglycinate chelate form, and that dose would probably be around 50 milligrams per patient. It might be more. If the person has immunocompromised with cancer, it might not be. So that was a basic summary of a lot of the general ideas regarding cancer overall. As you can see, as I promised, this was much more of a talk about cancer in general rather than just prostate cancer. I would appreciate your comments, and I appreciate you listening to this talk. You've been listening to Dr. Michael Wald, that's me, and this is part of my Ask the Blood Detective radio show on prnfm.com. You can find all of my shows on my website at intmedny.com, or my other website, which is the same website, drmichaelwald.com. And please let me know what topics you want to hear by sending them at info@blooddetective.com, and only use my phone number if you want to work with me one-on-one. I do Zoom conference distance calls as well. My number is 914-552-1442. Thank you so much, and hope to see you again soon.